My name is Katie Dolan, and I am here to represent a caregiver perspective for National Healthcare Decisions Day. So I'm just here to share a little bit about my role as a caregiver. So I began my role as a caregiver in March of 2020 when my mom was diagnosed with stage 4 lung cancer. I knew immediately that day that I wanted to be involved in every step of this journey with her. My mom has been a huge support for my brothers and I always. And the last thing that I wanted was for her to feel alone in all of this. But what I didn't really take into consideration at the time or start to process right away was the emotional impact that it would have, sort of experiencing cancer from the sidelines. And the last 2 years have really given us a lot of time together, in my role, driving her to all of her appointments, sitting in on the discussions with her medical team. And more recently, I've been fortunate enough to be at home with her, which has also given us a lot more time together, more time to have those tough conversations and sort of start to address what's next as we get through each day. It definitely hasn't been easy, but I am amazed at all of the support that we have. So, just about a month ago, during one of my mom's treatments, one of the palliative care nurses encouraged her to start thinking about delegating a healthcare proxy. And truthfully, I was so relieved when the topic was brought up that day, because it opened the door for an opportunity for my mom to ask more questions and for us to talk about this more. Because no matter how much you read or you think you know about advanced care planning, it's so different when it hits that close to home and nothing can really prepare you for it when it's your own family. So, shortly following that day, my mom had asked me if I would be her healthcare proxy. And I knew that there was a level of trust that she had that gave her confidence when asking me that if and when the time comes, I will be able to honor her wishes. I've seen her go through so much already, that I truly believe gives me the emotional strength to be able to handle it when the stressful times do come, be able to speak on her behalf. I think the most important thing is that there is no manual to follow. There's no protocol, for being in this role. Things change so quickly that it's important to have those tough conversations sooner rather than later, because you just don't know what's coming down the pike or how quickly. So, having those conversations, taking note of the person's feelings, certain comments that they might make, regarding certain situations and how they feel about things, so that you have a clear idea of what their wishes are. And more importantly, knowing that you have the bandwidth to put aside your own wishes and be a voice for that person when the time comes. I think, asking them what quality of life looks like for them, what's important to that person, and how they want to be cared for, where they want to be cared for. If it comes down to needing more help at home or being in a facility, and how far they really want their care to go, making sure you know what quality of life looks like for that person so that you can truly honor what their wishes are when the time comes. Those conversations, I've learned, are definitely ongoing. You don't get all of the answers in one conversation, and that's okay. They're hard topics, but allowing the person to speak and share their feelings and their perspective and what they would want is so important that it's definitely not something to put off.